Right, we're back again with Grazel, and today we're talking about professional boundaries in particularly individual therapy, because we all know that working with a therapist, particularly in the long term, it can start to feel a bit personal. But I know, Grazel, you have a professional duty to put those boundaries in place. Can you just explain how that actually protects the client?
Yeah, so it is something that we abide by, the legal and ethical guidelines as that we abide by as therapists, as professionals, is that we look at dual relationships. If there's anything that in the relationship that's crossing the professional and counseling boundary, then we have to really be aware of that because then that could harm the patient's ability to take care of themselves. So I think it's really important.
Yeah, and when you say dual relationship, what sort of thing are you meaning there? How do you define that?
So again, like dual relationships are relationships that crosses the boundary of professionalism and counseling. So it could be sexual, financial, social dynamics where maybe the patient and the therapist are becoming friends within the context of the therapeutic relationship. That's not okay. Maybe the patient is being asked to share more finances to the therapist. That's not okay. Sexual relationships, not okay. None of these are acceptable, by the way. So when I say not okay, might be I'm minimizing the impact of it, but I just want to say they're unacceptable. If your therapist is crossing the boundary and moving towards that direction, that's not professional counseling.
And does it go the other way as well, as in these are things that you as the patient should not be asking of your therapist? Like it's inappropriate to ask your therapist to loan you money or things like that.
Absolutely. Yes, absolutely. And it's inappropriate for you to engage in sexual relationship, financial relationship, friendships while you're in therapy with your therapist. Um, so it's a little bit, there's nuances there, right? Like a lot of patients, because they can have a very vulnerable and deep relationship with their therapist, sometimes that dependency that's needed in the beginning of the work for creating a healthy relationship with the self can sometimes feel like it could blur the lines, or it's blurring the lines, but it won't actually cross that boundary if you're able to talk about what you're feeling about your therapist.
Mhm.
What I mean by that is that it's not uncommon for patients to have a strong feelings for their therapist. The therapist is there to provide safety and security. And that's very attractive when somebody listens to you and just pays attention to you and you're the only important person in that moment. Um, there's something really safe about that. So patients can feel more than just a professional feeling with their therapist that can tap into maybe a romantic feelings. And I encourage them to talk to their therapist about that. It's called erotic transference. So if that happens, it's important for you to talk about it so that you can work on it in a professional way.
Mhm.
Yeah.
Yeah, I hear that. Um, let's say you're someone who's discontinued therapy for whatever reason, um, whether something inappropriate happened or not. Is it ever okay to go back to the therapist that you stopped having sessions with, or should you always find someone new?
It depends on the reasons why you left the therapist.
Mhm.
If you ended that relationship in a healthy way, and you feel that you can go back to that therapist to uncover other things later, I think that's a good thing because that therapist already have a good understanding of you, who you are,
Mhm.
especially if you don't want to repeat your history to a new therapist. Um, and at the same time, if that therapist that you left, um, if you had a healthy termination with that therapist, but you're looking for a new treatment modality, you don't necessarily have to go back to that therapist if that therapist is not specializing in a certain thing that you need
Mm.
help on.
Yeah, and just going back to something you said a moment ago about it's common that a client might start to develop feelings for their therapist or things like that. Obviously that potentially can end the relationship, but how do you help clients navigate feelings of attachment, that kind of feeling of dependency on your end? Are you able to manage that?
Yeah, absolutely. I mean, there's secure dependency, and at times that's part of the work, right? Is that we become the object of safety. We can also become the object of, you know, a person that harmed them in the past. So, but when it comes to secure dependency, that's part of the journey in creating a healthy sense of self.
Mhm.
So if they need to depend on me in the beginning, I would like them to until I am able to, give them the steps to be on their own. And by then, they don't need to stay with me in therapy. They've attained internal security and dependency that they don't need me there anymore. So that means they've gotten better.
Yeah, and I guess ultimately that's your role as a therapist, isn't it? To get the client to the point where they don't need you anymore.
Yes, yes.
So if a client becomes unsure about their therapist, maybe that they're doing something that feels like they're crossing a boundary, or um, they're starting to feel some feelings that they don't particularly like. What happens in that scenario? What should the client do? What should the therapist do?
I encourage clients to talk about it,
Mm.
to name what they're seeing in the room and then in their relationship. If they want to, again, I want them to have the autonomy to decide for themselves. Um, I think you, me, and others know when it doesn't feel safe. I think there's just part of us biologically that know what feels threatening.
Yeah, I guess with the exception of people who have been through significant trauma, because those instincts can get overwritten, can't they?
Yes,
To a degree.
but they still know. There's still that part. They still know that this is not okay, but it's become normal in my environment that, well, it's not to be expected and they just kind of roll with it. But they still know it's not okay. Now, if that any of those things that feels threatening in their home environment happens in a professional environment, then they need to talk about it
Yeah.
because that's when they're going to find the healing. Hopefully, if the therapist is able to receive their worries
Yeah. And in
about the relationship. Yeah.
California, is there anywhere people can go if they feel like, no, this just really doesn't feel safe in this environment? Would you recommend they report to the therapist if they've tried talking to the therapist and haven't really got anywhere, or how would that work?
They can. I mean, we're all, the therapists were registered with the state.
Mhm.
Our licensure is registered by the Board of Psychiatry or Psychology or Behavioral Sciences. So if they feel that they're being harmed by their therapist and the therapist is crossing professional boundaries that's harming their sense of identity and safety, they can definitely call the board. And we are required to give the phone number and our license to each patient. So they receive that when they start therapy, and it's included in their documents. So they can just call and report and complain about us if they want.
Yeah.
Yeah.
Hopefully that's never ever needed. I'm sure it's never happened to you or anyone in
No,
practice.
no, that's never happened. We take pride in what we do and really there to create safety and security for everyone that comes through our practice.
That's exactly why these kind of regulating bodies exist, to provide that
Yeah.
safety. Yeah.
Yes.
Um, okay. Well, thank you again for your time, and I'll speak again soon.
Thanks, Scott.